one is our gritty one.
I love soccer because I just feel like one of the things that I had passion for.
She's feisty on the field.
One day my back felt sore.
We just took a peek at her back and it was just kind of inflated almost on one side. We realized it wasn't normal and we took her to the chiropractor, and that's whenever he had said, you should go get some x-rays. And that is kind of what started the process of us finding out she had scoliosis.
They'd say, Brooklyn, you're walking crooked again. And so I'd have to straighten up, but it felt like hard, like I couldn't.
We did physical therapy. We tried all sorts of things to help her maintain her back. Our last resort, we felt like, was the surgery.
We operate on scoliosis once the curves cross about 45 to 50 degrees. I mean, here you're looking at the progression of her x-rays.
Dr. Kishan actually gave us two options.
The typical treatment of scoliosis is a brace between 25 and 45 degrees.
We were in a prime situation where Brooklyn was an ideal candidate for the tethering surgery.
Brooklyn spoke up and she said, that's what I want to do.
Let's go for the tether.
So the tether is a very unique operation. This is the actual tether that's been put in a model spine. So these screws are the screws that you see on the x-rays that go in the front of the vertebra. And after all these screws are placed, this braided polyester cord is placed inside the screw heads. And then you see a little set nut here that is torqued down so as to hold that cord in place. And then you compress the two together and then torque that one down. Compress these two together, torque that one down. That's how you keep going up the convexity of the curve. Her initial curve was over 50 degrees. So she was in the operative range for scoliosis. And the goal of the operation was to do a fair amount of correction during the surgery itself, but to harness her growth to continue correcting it even after the surgery. So as she continues growing, the spine will keep correcting itself and keep going.
She has full mobility, full flexibility. There's no pain.
And there's a very big change in between then and now.
Sky's the limit, right?